Hi, welcome to Vitavege Services. In today's episode, we are going to talk about diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder that manifests as hyperglycemia due to abnormal metabolism of carbohydrates, proteins, and lipids, resulting from a defect in insulin action, insulin secretion, or both of them. In simple terms, let's picture this. Let's say you have a carbohydrate-containing diet. You consume this food or this diet, and it undergoes digestion. The end product, which is glucose, is absorbed into your bloodstream. Then, your pancreas comes to play. The pancreas has cells called the islet of Langerhans. These cells produce insulin, and insulin acts as a messenger to transport excess glucose from the blood into the cells for storage or for energy. But in diabetes, this balance is disrupted. So, there is either inadequate amount of insulin to compensate for the increasing blood glucose levels. Hence, there is a less amount of glucose that is transported from the blood into the cells for storage or for energy production. Or, there may be no insulin at all due to an autoimmune disease which might distract the insulin-producing cells of the pancreas. So, diabetes can be broadly categorized into type 1 and type 2 diabetes based on this analogy. So, for type 1 diabetes, an autoimmune condition or any other health condition may have distracted the islet of Langerhans. Hence, there is no production of insulin at all. And in type 2 diabetes, there is increased insulin resistance or reduced amount of insulin in the blood. Hence, less amount of glucose can be transported from the blood into the cells. And these two conditions will result in increased glucose in the blood that manifests as diabetes mellitus. So, for the risk factors of diabetes, we have obesity, sedentary lifestyle, hypertension, polycystic ovarian syndrome, consuming high-calorie diets, and then a positive family history of diabetes mellitus. And for the signs and symptoms of diabetes, I have a handy mnemonic to help you remember them easily. And the mnemonic is diabetes. D for diuresis or excessive urination. I for infections. A for acanthosis nigricans. This is where your skin darkens at certain parts of your body. B for blurred vision or the diabetic retinopathy. Then E for excessive drinking, that's the polydipsia. Then we have T for tiredness or fatigue. E for excessive hunger or the polyphagia, where the patient gets hungry too much and hence they tend to eat a lot. And S for slow wound healing. Remember that anytime you see any of these signs and symptoms, you have to visit the nearest health center for early identification and management. For the treatment options for diabetes mellitus, we have the pharmacologic treatment and a non-pharmacologic treatment. The pharmacologic treatment include insulin and other oral antidiabetics like biguanides, sulfonylureas, and the dipeptidyl peptidase 4 inhibitors. For the non-pharmacologic treatment, I categorize them into the lifestyle modifications and the dietary modifications. For the lifestyle modifications, one can avoid smoking, cessation of alcohol, and then increase exercise or activity to help improve insulin activity and secretion. Now for the dietary interventions, I'll first want to explain glycemic index before I go on to talk about the dietary interventions. So glycemic index refers to a scale that ranks carbohydrate-containing diets based on how quick or fast they release glucose into the blood. So for a diabetic patient or anybody that is prone to diabetes, you have to avoid certain foods like potatoes, beets, and carrots. These meals have been proven to have a high glycemic index, putting consumers at risk of developing diabetes. Hence, for someone who is diabetic or anybody that is prone to diabetes, a better option or alternative would be foods or meals with low glycemic index. And these meals include wheat, oats, peanuts, and lentils. As we wrap up today's content on diabetes, remember, knowledge is most powerful when shared. So help us raise awareness by liking this video, sharing it with your friends and families, and subscribing to our channel. And together, we are going to create a vibrant community, reducing the prevalence of diabetes. Remember, one share at a time.